Good afternoon, everyone. Thank you for joining this session. A quick kind of housekeeping before we get the presentation started. If you're on a seat with one of the consent forms, we will be recording some of this session. So if you're not comfortable being apart or in front of the camera, you can find a different seat, or you can sign that consent form letting us know that you're cool being recorded. Besides that, feel free to grab the notebooks, pens, candy throughout the presentation. It's going to be riveting. And without further ado, I'm happy to introduce Francesca Toledo-Alexander, Senior Program Manager of the Environmental Health and Emergency Preparedness Portfolio, on this discussion about breaking down silos. So passing over to you, Francesca.
Thank you, Jaime. Thank you all for joining the session today. We'll start with our CDC funding acknowledgement. Give you a moment to read that through. And today I'm your speaker, Francesca Toledo-Alexander, a senior program manager here, so I get to oversee our Project First Line team. And today's learning objectives will be increase awareness of the role public health institutes have in reducing silos between public health and healthcare. We'll describe the scope of IPC activities within NNPHI's member network to identify workforce gaps, and formulate actionable strategies for PHIs to advance equitable and sustainable IPC practices. A little bit about NNPHI is we are a 51-member public health institute, and we really look to support national public health initiatives and promote multi-sector activities. You can find out more on our website. And this is a really good graphic to see state by state what public health institutes we have. And this is available on our website as well. And we'll start by taking a quick Mentimeter poll. Just what type of partner are you looking for? So if you can, scan the QR code. It'll be a word cloud. We love them here in public health. And I'll wait for the results to come in. All right, we've got some words coming through. Some of the partners that we're looking for are healthcare partners, community centers, CBOs, reliable partners. That's very important as well. Youth serving providers, community members, yes, absolutely. All right. Thank you all for participating in our word cloud. And we'll go to the next slide. So NNPHI and Project First Line, we'll give a little bit of background. NNPHI, in collaboration with the CDC, is responsible for engaging the public health workforce in Project First Line. We're committed to preparing frontline health workers and public health workforce to protect themselves, their patients, and their communities from infectious disease threats. It is a collaborative and work with 75 healthcare academics and public health partners to reach healthcare workers across the country with infection control education. And Project First Line, some of the activities that we've completed to date, this is our year 5. And we support national public health workforce and educate the next generation of IPC workforce. We've helped in initially the COVID-19 education efforts. We have developed some animations and recently completed our Advancing Infection Control and Prevention webinar series. This is available on our YouTube. And then yesterday, we completed our first in-person workshop, Bridging Gaps Between PHIs and Healthcare Workshop. And another piece that we work on is educating the next generation of IPC workforce. That's the MPH curriculum development, where we've partnered with USF, IU. But all of this work cannot be done without our full team. This is our environmental health and emergency preparedness team. But internally, we collaborate as well. For this eScan, we used our communication team and our network engagement team. So the environmental scan on infection prevention control activities among our members. A little bit of background on that was from August to September 2024, in collaboration with NNPHI and Banyan, we conducted an environmental scan to gather critical information on infection prevention and control, practices and activities within NNPHI's network member organizations. Banyan reviewed and collected relevant information from the public websites of our members and social media accounts for 49 network members. The findings from the scan will inform our ability to disseminate Project First Line related materials across its member network effectively. And these goals that we identified with Banyan were to organize around 2 central guiding goals. We wanted to understand infection prevention and control in public health and identifying the specific infection control activities that each of our member institutes are conducting. So each of these findings directly align with these objectives to support NNPHI's dissemination efforts. We wanted to identify COVID-related activities, map our IPC and associated activities, understand collaboration opportunities, assess our members' social media presence, and identify dissemination hubs for Project First Line materials. Some of those findings from the 49 organizations, there were 5 public health institutes that implemented a COVID-19 intervention in a healthcare setting. And our goal 2, to summarize the work conducted by network members in relation to IPC and adjacent areas. The highest of the areas was 30% of the network members engaged in epi and disease surveillance and reporting. And for our goal 3, which aimed to understand collaborations between network members, state and local public health departments, we found that members were working 45% with state health departments, but more with their local health departments at 65%. Additionally, for goal 4, we looked at our social media presence within our member institutes and found that Facebook was identified as the most popular social media platform. Additionally, LinkedIn, for one single organization, was found to have the highest reach. And that institute was the Public Health Institute of California. And this is important because we want to disseminate our findings, and knowing the platform that is most used, identified here, will be relevant for our dissemination. And from the findings that Banyan had, they identified 5 institutes with the highest total reach across their social media accounts: the Public Health Institute of California, Public Health Solutions, Public Health Management Corporation, the Puerto Rico Public Health Trust, Institute for Public Health Innovation. What are champions? We identified what we wanted was who is a champion, who can be a hub for our goal 5. We identified that member network who could play a crucial role in supporting the dissemination of Project First Line materials. And from that, we found that COVID-19 related activities were these dissemination hubs. These were the recommendations. These were the top focus from the environmental scan in healthcare settings. And then additionally, they identified for IPC associated activities and fostering collaboration, we have 10 recommendations from them that were identified. These are looking at their external websites, partnership opportunities, and really hoping to give us those recommendations so we can disseminate out. And from that scan, the recommendations were to encourage our members to highlight IPC and IPC adjacent efforts easily and more accessibly on their website. So there were links that were not completely linked anymore. We want to make sure that they recommended that we talk to our institutes to have their websites updated and regularly update those. But also, if they're partnering with other organizations, be more specific about it. There were 3 or 4 links till you got to who they were partnering with. So really minimizing that down and having the full picture on their website. And they did recommend to conduct direct outreach to members. But overall, we had successes, challenges, and opportunities. Some of the successes were that we had a full list of champions that we can use in our next phase of work. When we began this scan, we didn't know who to partner with. We didn't know a lot of information about IPC activities within our member networks. So this scan really helped identify those champions for our next phase of work. It was limited to just website presence and website information. They did not directly outreach to member institutes. And it was only to 45 of our PHIs. So this also showed that we have opportunities to collaborate more efficiently. But this leads us to our second phase of the e-scan, where we conducted listening sessions. We did outreach by email to each of the recommended public health institutes, and we were able to conduct 6 interviews from November to April. From those interviews, we did invite everyone to our in-person workshop for Project First Line. And again, here were the follow-up calls that we were able to conduct with the Hawaii Public Health Institute, Mississippi Public Health Institute, Puerto Rico Public Health Trust, the New Hampshire Community Health Institute, MCD Global Health, and South Carolina Institute of Medicine and Public Health. Some of the questions that we asked were mainly around these 6 topics. We wanted to know what clinical healthcare partnerships they had, how they developed that partnership, and the relationship management, if they were collecting data and how were they reporting out that data, and these were all based around IPC. If they had related programs, and what future interests any of our member institutes might have. Hawaii Public Health Institute, we'll just go over a few of the interviews that we were able to do. They are collaborative with their FQHCs, they have clinical partners, and they have coalitions. They were able to have real-time data translation and outreach to their non-speaking communities. But Hawaii Public Health Institute focused on community engagement. They were very active with their community and knew their community. Mississippi Public Health Institute developed regional infection prevention specialists and IP short courses via HealthStream. So that's another opportunity where we can uplift those resources still. They promoted through social media and have an antimicrobial stewardship and resistance education. The Puerto Rico Public Health Trust is emphasizing the community health workers to deliver IPC education and vaccine promotion. They developed educational materials, hosted community events, and tracked outreach through those data tools. They still maintain strong administrative partnerships and communication channels with clinics. The New Hampshire Community Health Institute has led an ECHO project for IPC and long-term care facilities, and they provide audits, training, and policy recommendations, and they really work to integrate IPC with emergency preparedness and health systems. NCD Global Health designed custom IPC training and resource hubs. They offer webinars, in-person sessions. They have a 3-tiered IPC learning pathway. And they worked with EMS and FQHCs on IPC and ambulance and rehab settings. So from those listening sessions, we learned a intense amount of information about their IPC activities, but really connecting what they've done at the beginning of Project First Line to now. And after meeting with them and their organization, we helped to connect those activities to really highlight Project First Line as well, connect with them, build those partnerships, and figure out dissemination methods or ways that Project First Line can commit to connecting with them in the future and learning about their current issues. If it's messaging at the policy level around COVID-19, but changing terms. We're discussing relevant issues if it's policy or at the community level. So they were enlightening listening sessions for each of our member institutes. So now we'll start with an activity. We want to do resource sharing, and so the goal of this will be to provide the opportunity for partnership, bridging our gap, and hopefully share some support, give, and what maybe you all need. This activity, if you can, we want to identify and articulate what can we offer as individuals to others that's at your table. How can you support other organizations? What resources does your organization have to share? And we can relate this around IPC. And how can other organizations support your efforts around IPC or other activities? So we'll take some time. If you can, share with your table or 1 to 2 people, just referring to support for your organizations. So remember, today's activity is about building those meaningful partnerships and recognizing what you can give to others and what we need to grow.
If you have any questions on where resources, I can share the link with you.
And here's a slide for the give. It's a little bit bigger. How can you support other organizations? What resources, expertise, or connections can you offer to others? And maybe just share your top 2 to 3 resources that you have available surrounding IPC. Okay, so that was just a little bit of time. If we can go by each table, and if you want to share just a few, maybe some summaries of what you've discussed, some of the resources that you were able to discuss and share. We can start with this table. Maybe if you've had enough time, I don't know, like a little bit more time? That's perfect. Okay.
Also, we need a little bit more time, if that's okay.
Yeah, absolutely. Okay, everyone, how about now? Just one resource or just a summary of what your table discussed. We can start on the corner. Again.
One summary we can.
What kind of partners do you have, and maybe just, what resources could be shared?
I think something we discussed was rural communities, rural health department,
Yes.
rural university, and the relationship
Yeah,
that
absolutely.
they play in supporting each other.
Okay. Rural health.
Yes.
Rural resource deficient?
We're getting there.
Opportunities? Okay. This table?
I will open up the table.
Okay.
I would say, and please fill in, I would say that at least 2 of our resources were definitely our exposure to different types of populations we work with.
Yes.
Really leveraging their unique experiences and also language.
Mhm.
And being diverse in who we're working with. I would say Julio, he was saying how he works with not only adults, but he works with the youth as well.
Okay.
So they bring a little bit more of a fresher perspective
Yes.
to what the work is doing. So I would say those are our top 2.
So tailoring messaging to your audience,
Exactly.
especially when there's such wide ranges. Yeah, absolutely.
And bringing the community, I would say, to decision-making table
Mhm.
with informed strategy.
Okay, perfect. Thank you. The table over here?
Yes, I think when it comes to resources, we had that discussion too, where it's not just what your audience is, but especially when it comes to infection prevention control, like how much information, because you also don't want to give it too much where it's too overwhelming, or where you can start finding different sources of information from other places, like if your health department is saying something different from what you're saying, just because the language is a little bit more technical, it can
Yeah.
be just to us, so really trying
great. Thank you all. Well, we're doing the same thing, but this is now, how can others support your work? Are there 2 to 3 IPC resources that we can provide or you can share? And I'll give it a couple minutes. Okay, so I know it was a little bit of short time, and we did discuss like having a shared message for our population on giving out resources. So what about this table? What did you guys discuss about getting resources? Focused around IPC or just in general? Funding, yes. Yes, okay, good. And anything else to share?
We also talked a little bit about keeping relationships even when there's not an emergent or something that's urgent.
Yes, yes,
That's important for them when there is an emergency.
yes.
We're not starting from scratch.
Yes, I mean, COVID-19, we were all hands on deck, and now where's our partners, right? Okay, great, thank you. How about this table? Yes, data, timely data and accurate data, right? Okay, great. Would you guys like to participate?
Yeah, we talked about the collaboration.
Great, thank you. And so we have another Mentimeter question. But this should display what knowledge, skills, or services in IPC can your organization share with others. So we've already discussed some of that. What's on your end, I guess? What do you, because it should be like a checkbox.
It says get ready to play.
Okay, well, we will discuss this, and sorry about that. Technical difficulty. We already did discuss some of the resources that you have available. If you can say what skills or services in IPC your organization could share with others. And that can be training. That's workforce capacity. So one skill or service per table, and I'll give that 2 minutes. Yes. What knowledge, skills, or services in infection prevention control can your organization share with others? So Project First Line, we do have our webinar series that just recently completed. We can share that on our YouTube. We can share that with you. What's something your organization can share with others? Trainings, or do you need trainings? Okay. We'll start over here. Any skills or trainings that your organization can share with others?
I'm at East Tennessee State, so for us it's research and evaluation is a big one on the academic side.
Okay. So research and evaluation. Okay, very cool. Here?
I can share.
Yeah.
So I'm from the State Health Department in Kentucky, and we have different trainings that we put on for partners in the state. One of those is called Be Ready, which is very
Mhm.
CDC funded program,
Mhm.
and it's got different skills and knowledge around disease prevention, transmission models, and all those sorts of things.
Awesome.
From a very wide perspective.
And can anyone attend, or is it just a specific
Well,
audience?
they're in person, so this you can come to Kentucky.
Yeah. Yeah.
But yeah, I think we're going to extend those.
Okay, so in Kentucky, Be Ready training. Perfect. Thank you. Would you like to provide a training?
Yeah, so the NNPHI has a microsite with all our IPC materials,
Mhm.
and the Public Health Learning Navigator also has complete learning pathways on IPC. That captures most of the events.
Thank you. Okay. And so from that activity, it is, we meet each other, we collaborate, but what can we give each other? How can we help each other out with supporting and with our resources? What did anybody learn? What surprised you? Did you discover any shared needs or offerings? And were there potential collaborations that you may have uncovered? We'll give that a couple minutes as well. Yeah. Did anything surprise you when you were discussing or discover any shared needs. Go ahead.
I would say that maintaining participation in coalitions, like Julio had mentioned that in his group, they have a great group, but
Yeah.
when there's turnover, it does impact the progress. But I would say progress. And I have found similar situations with the people I support as well. So that was interesting to see that like we all are sharing that.
Yeah.
And I think maybe we won't connect later. Like how can we like get people to stay in the coalition, stay engaged?
Yeah.
And when people leave, that's a different thing. They have a right to leave.
Yeah.
But how do we maintain that so when that institutional, it's not, so the institutional knowledge isn't lost to the person?
Absolutely, yes. Are we sharing business cards? Are we sharing contact information so that you can reach out and keep that as well? So thank you for sharing that because it is important. Staff turnover, keeping people trained, keeping people engaged, very important. Thank you. How about over here? Anything surprised you from your discussions or collaboration opportunities that you may have identified?
I don't think anything surprises me. I will agree with her comments that I think at one point in time, all the partners are at the table, but it's just keeping them coming back.
Right. Okay. Engagement and it's very big, yes, understandable.
It's not just passing on, like if somebody leaves and someone else takes their place. It's just how do you keep that organization involved and engaged.
Yeah. Thank you. Okay. So in the same sense, how do we stay connected? How do we continue to keep this conversation going? We may have identified silos within our eScan because of the not knowing what our member institutes were working on within IPC. But, we want to think about who could you partner with. We've done that today. Where can we bridge those gaps? And what's a next step that we can take in the next month to follow up? Some things that from this exercise regarding IPC, how can we do that this week? Our team is here. What IPC related resources can we provide to you all? Or can we reconnect at NACHO or a further conference? How can we all just stay engaged? And some of the resources that Diana talked about were the learning pathways. That's a free resource training. And our YouTube, we have the webinar series available. So those are continuing education. Let's see if this one works. In the same sense, what should we prioritize in Project First Line, NNPHI, with our IPC, resources, trainings? Provide your information, please. Okay, partnerships. And yes, we talked about maintaining engagement, trainings, or impactful outcomes. Wonderful. Okay. And you can keep adding. The next slide will be questions. So if you have questions, please let me know. Environmental justice, absolutely. Shared resources, yes. And move this up. Understanding things that PHIs are doing. Definitely, how do we communicate out what our members are working on? That's a big piece. Okay. So, any questions today? And here's our Project First Line microsite and my email if you have any questions.